Hello everyone, I'm Robin Ely and I am a registered nurse. I've been a registered nurse since 1993 and I also hold a Doctor of Nursing Practice degree. My focus of study and my manuscript revolved around dementia care and the best way for caregivers to provide dementia care to a person affected by dementia. So today I'd like to do some quick and easy tips on the subject of communication. Communication is often very difficult for caregivers and for the person with dementia. The person with dementia often cannot make their needs known properly, and they can often not follow directions or a response from the person that's giving care. Caregivers can be frustrated relaying information, getting a response, or even hearing repetitive comments and questions. So I hope these tips help. When we talk about communication, we need to talk about verbal and nonverbal components of communication. So here's a rundown of some tips for you. You always want to speak slowly and clearly. You don't want to use too many words. You want to be mindful of your tone, your pitch, and your pace. You need to wait for a response. You want to let the person with dementia answer independently as much as they can. And you may want to load a question or offer limited choices. So an example of that might be, instead of saying, "Hey mom, what do you want for lunch? There's soup, there's chicken salad, there's tuna, there's bologna. What do you want? Is there anything I can get for you for lunch? It's lunchtime." You need to slow down and you might need to just offer a couple of choices instead. "Hi mom, it's lunchtime. Would you prefer soup or a sandwich?" And then let her respond. And she could say something like soup, or she could say a sandwich, or she could say a banana, but give her time to respond to your question without overloading her with too many facts. You want to avoid shouting. You do not want to argue with someone ever. They're just not going to understand what you're arguing about. And even though it makes perfect sense to you, it's not going to always make sense to the person with dementia. So for some non-verbal components of communication, your hands. You always want to keep your hands in a non-threatening position. Your palms up is always more inviting and warm and non-threatening. Closed, relaxed, never crossed. And if you do happen to get frustrated or excited, you don't want to have your hands waving in the air, even if you naturally talk loud and excited and with your hands like so many people do. You really want to keep your demeanor calm. You want to maintain eye contact. You want to smile and be pleasant. And those are my tips. I hope that these tips help caregivers. You might need to try more than one. You might need to try them over and over again and just keep practicing. You're doing a good job giving care. And if you'd like any more tips or any more information on Mind Matters, please visit the website mindmattersct.com and look out for more of my tips. Thank you.